Imagine finding a hidden diagnostic signal just by pressing gently on the ear and seeing the pulse change instantly. That's exactly how Dr. Paul Nogier stumbled onto one of acupuncture's game-changing discoveries in the 1960s.
You're describing the auriculo-cardiac reflex, right? Nogier's observation kicked off a whole new field, auricular medicine. Today, we're diving into how pulse-controlled laser acupuncture leverages this insight, what the RAC or VAS response is, how it works, and why it matters.
We'll unpack the science behind the pulse reflex phenomenon, explain the practical clinical applications, and explore how laser frequencies create therapeutic resonance. Plus, we'll touch on how stress reactions ripple beyond the patient.
Here's our roadmap. First, Nogier's historical discovery and the shift from RAC to VAS. Second, how clinicians use pulse feedback for diagnostics and treatment. Third, the principle of laser resonance. And finally, the surprising ways microstress signals can spread through both animal groups and therapists.
What blows me away is that Nogier's discovery started from such a simple observation, pressing certain ear acupuncture points and noticing subtle changes in the patient's radial pulse. It wasn't the pulse rhythm changing, it was the amplitude.
That's right, and Nogier verified this over and over. He called it the Auriculo-Cardiac reflex, or RAC. It represented the body's instantaneous response to energetic or sensory stimuli, basically a quick adjustment by the autonomic nervous system.
And it's fascinating, because by monitoring these pulse changes, practitioners could identify which acupuncture points were active or disturbed, tailor treatments, and even track real-time feedback during therapy.
Exactly. It transformed diagnostics. The pulse became a living indicator not just of cardiovascular health, but of the body's overall energetic balance and response to therapy.
Funny you mention energetic balance. Later research found the RAC wasn't confined to the ear. Stimulating points anywhere on the skin could trigger similar pulse modulations, and that led to the term vascular autonomic signal, or VAS.
Professor Pierre Magnin helped refine that concept. VAS is a broader physiological response, hinting at a general regulatory mechanism across the body. It's not just about local reactions, but systemic feedback.
The core idea: when a relevant acupuncture point is stimulated, whether through pressure, touch, light, or frequency, the pulse amplitude shifts for a few beats. It's like the body's own microstress signal.
That microstress is crucial. Practitioners can detect it by palpating the pulse, especially in humans and small animals. Though, horses pose a challenge due to their slower pulse and size.
That actually reminds me, the evolution of pulse-controlled laser acupuncture took these insights even further. By combining VAS-guided diagnostics with laser therapy, clinicians can precisely localize active points, choose individualized frequencies, and adjust treatment in real time.
It's dynamic medicine. The practitioner watches the pulse for immediate feedback, identifying not just acupuncture points, but also disturbance fields, areas that disrupt physiological balance or block qi flow.
And when those points are stimulated, the organism responds with a brief microstress reaction, visible as a transient change in pulse amplitude or tension.
The beauty is in the adaptability. If the pulse shifts, the therapist can tweak laser parameters or frequencies instantly, making the approach both precise and responsive.
Could you unpack the resonance principle in laser acupuncture? How do Nogier and Barr frequencies fit in here?
Sure. Both Nogier and Barr discovered that specific impulse laser frequencies enhance diagnostics and therapy. For example, Nogier frequency A targets acute inflammation and disturbance fields, while frequency B supports wound healing.
So, the therapist selects a frequency, transmits that therapeutic signal via the laser, and aims for the cell or neural system to resonate with it. When you hit the right frequency, the response is optimal with minimal energy.
The laser acts as an information carrier. The frequency must match the biological receiver for effective resonance, almost like tuning a radio to the right station for the clearest signal and strongest response.
One aspect that's underappreciated is how stress reactions aren't just limited to the patient. They can actually transfer from one creature to another. Think herd behavior in wild animals, where one individual's tension spreads fast.
I've experienced something similar during therapy sessions. When a patient's pulse shows microstress, the therapist's own pulse can subtly shift, reflecting a kind of vegetative interconnection. It's a reminder that therapy is two-way, energetic exchange.
This energetic responsiveness highlights how laser acupuncture isn't just technical, it's deeply relational. The body, the therapist, and even nearby animals can share these microstress signals.
It adds a layer of complexity. Practitioners must remain aware of their own physiological responses, as they can indicate not only patient feedback, but also shared energetic states.
Let's wrap up with some key takeaways. First, Nogueir's pulse discovery transformed acupuncture into a reflex-driven diagnostic and therapeutic system.
Second, VAS-guided laser acupuncture allows for real-time individualized treatment, making therapy both precise and dynamic.
Third, the principle of resonance means that matching the right laser frequency with the biological target is crucial for effective therapy.
If you're interested in applying these ideas, start by learning to palpate for subtle pulse changes during acupuncture or laser therapy. Use pulse feedback to guide point selection and frequency adjustment.
Thanks for joining us.